This is a previous patient who we have a video on, who had a significant sacral ulcer as well as a right hip ulcer. During the previous visit, we did a surgical debridement. Since it was an unstageable ulcer, meaning we didn't know the depth of it, we removed all the necrotic yellow tissue. Now we're exploring his wounds 2 weeks later. The nurse has been seeing the patient 2 or 3 times a week. The wife has been the instrumental person taking care of her husband as well as doing the wound care. He's on his side right now to expose both the right hip and the sacrum. We're just applying underpads or chucks so we can keep the mattress and the bed clean. You see right now they're adhesive waterproof foam dressings, which we're going to remove. We just discovered that he had a significant bowel movement, which we will change. We're coming back after we cleaned up the bowel movement. The wife is helping me find all the supplies. She's very organized. Unlike in previous videos, I've used pink gloves. We have some nice green nitrile gloves here. I'm just getting ready to remove the dressings. He's in a perfect position. I'm commenting on how much better the sacral wound is. During our last visit, there was a lot of what's called deep tissue injury or beginning of dead tissue, as well as an odor. Now it's much cleaner. It's a little bit smaller. It's beefy red inside. We were doing a wet to dry dressing of Dakin solution. Dakin solution is basically diluted bleach. This helps remove the bacterial load or the biofilm. It reduces the potential chance for infection. We're going to switch to hydropharablue. As usual, I measure all of the wounds. This one is smaller. It's really clean. There's some undermining from 11 to 2 o'clock. Overall, I'm very happy with the wife and the patient's progress over the past 2 weeks. We're getting all our supplies. We clean the wound with normal saline solution. Most of the time, I prefer to use Vash. I don't want to use Dakins for too long since this can be what's called cytotoxic or not beneficial to long-term wound healing. Dakin solution is fine for acute infections, but not for long-term use. It decreases the action of a cell called fibroblast. This one is a right hip. There's some yellow and white. The yellow is a little bit of sludge, which is very small, but you see tendon, which is called the tender fascia lata. That's a tendon along the hip, which we see, and it's very clean, much better than 2 weeks ago after our debridement. We're going to use hydropharablue on both wounds. The hydropharablue is a polyvinyl foam that has both gentle and violet and methylene blue. These are both antimicrobial agents, meaning they decrease the bacterial load and help clean the wound. It looks more purple, but it is blue. I'm measuring the hip wound as well. Overall, I'm very impressed over the 2 weeks. She's also been able to increase his nutritional profile over the past 2 weeks. She's working very hard. She's managing this patient by herself. I'm using skin prep in my goodie bag. I always bring a lot of supplies and I hate to come underprepared. I do believe she has skin prep, but we couldn't find it when I was there. I'd like the skin prep to really dry off all the oils and create an adhesive barrier. It takes about 1 to 2 minutes to really work, so that's the first thing I do after I clean the wounds. And then we're getting the hydropharablue, which you can see. On the one on the sacrum, I'm going to kind of create a roll or strip of it and kind of fold it on itself to really pack the wound very well. As you'll see, I'm demonstrating here. That's for the hip. Now, the hydropharablue is like a hard cardboard you can't appreciate. This has to be moistened with normal saline solution. And you squeeze out the excess fluid. You don't have to be super saturated. You just want it to be soft. I'm just showing her to take off the kind of the tinfoil. It's not really helping, and it's obfuscating how much fluid is coming out. I'm putting a little sand on the material. Now, a lot of people, the board answer is to put the sand with a Q-tip right on the area of stuff. I think it's much easier to put on the dressing so you don't lose it. And since I'm an inpatient surgeon, I don't like to lose supply, nor do I want to spend a lot of time. I'm using an adhesive dressing, which I provided to the patient. The nursing agency, which is involved in the case, is trying their best to get supplies. They've just been a little bit slow in getting everything approved. This may be an insurance issue. So we're just using gauze along with the adhesive foam pad. As you can see with the skin prep, it really makes that adhesive foam dressing stick very well. For the one on the sacrum, I'm going to kind of make a coil here and kind of pack it into the wound and the undermined area. I'll cut off some of the hard edges. You don't really need to do this, but I just don't like to have hard edges. I should have discarded, or actually put the hydrophilic glue back in its container and wrap it with a Ziploc. I'll do that after I'm finished with the dressing. I'm just wetting this to activate the hydrophilic glue. You don't want to put it as a hard cardboard because it needs to be activated by saline. Now, hydrophilic glue does come in a soft foam. This is the cardboard version. It's not really cardboard, but it's hardboard that has to be activated by saline. You just want to get it soft. So I'm gently packing inside the undermined area and then the rest of the wound. I put it inside there. You don't want to overpack this because this absorbs a lot of fluid. The wife is critiquing my technique. She didn't realize I did pack the undermined area. I'm trying to explain to her not to overstuff it. And here we're using a sacral dressing. That's an adhesive foam. We're putting this in. This one's a very good one. This adhesive is very good and very waterproof, provides adequate cushioning. See, but these gloves I don't have to take off because they're not vinyl gloves, which are very difficult to use these type of dressings. They fold on itself. And that's it. Now, if I didn't have a good seal, I would reinforce it with either Duoderm or Tegaderm. We're going to discard our refuse. She likes to apply cream near the anal verge. That's generally it for the wound care. We're just trying to discard all of our refuse. I'm reinforcing the importance of turning as well as nutrition, which she knows. She's doing everything by herself. He also has a small wound on his other hip, which we'll show in another video. We're just putting everything back. And we'll also look at the shoulder area as well. Right now, I'm about to help her turn the patient. And that'll be it for today's wound care of the right hip as well as the stage 4 sacral ulcer.